Hello, I am Dr. Srinivas, a senior consultant pediatrician from Bangalore. I have been a member of the advisory committee on immunizations for the Indian Academy of Pediatrics. We are into the third year of the pandemic. In the initial phases of the pandemic, children were considered to be relatively spared from the effects of COVID. However, the second and the third wave, that is the Omicron wave, has changed our perception about the relationship of COVID and children. During the Omicron wave, a large number of children were affected. There was a very significant increase in the number of hospitalizations, not only in India, but throughout the world. COVID also causes some long-term complications in adults, which may be quite debilitating. There is reason to believe that even children to some extent may be susceptible to these long-term complications of COVID. So in short, COVID-19 is a disease which should be prevented by the available vaccines. Your child definitely needs the COVID-19 vaccines. COVID-19 vaccines have been rolled out by the Government of India in a phased manner. Initially in children between 15 to 18 years, in January this year, and subsequently in children between 12 and 14 years since 16th of March this year. The vaccines that have been rolled out are based on time-tested technologies that have been used for decades and which have a proven record of safety and the capability to induce protection. In fact, some of the childhood vaccines which have already administered to your child are based on these time-tested technologies. The COVID-19 vaccines have been studied in children, and these studies have again shown the very good safety profile and the capability to induce protection in children. Even if your child has had COVID in the past, please administer the vaccine. Studies have shown that people who have had the disease and have been vaccinated have much more robust protection than people who are either vaccinated or had the disease in the past and not both. If your child has some medical conditions like any lung problems, heart problems, diabetes, or kidney diseases, there is an even stronger need for this vaccine. Do not hesitate to administer these vaccines. Remember, COVID is not gone. There is now talk about a fourth wave in our country. Many countries in the world are experiencing a tremendous surge in cases now. India, the situation may not be too far away from India. So dear parent, go ahead, vaccinate your child and protect your child from COVID. Thank you.
हमने कोविड वैक्सीन लिया है, क्या आपने लिया है?
We pediatricians have done COVID vaccination of our children. Have you?